Hey guys, Justin here again. Today we're going to be instructing you on 1- and 2-person bag valve mask ventilation techniques. This is going to be performed on casualties who are unconscious, unresponsive, who are not breathing but do have a pulse. All right, so the first thing that we need to do is the provider needs to position themselves at the casualty's head. In this case, I'm going to put the casualty in a neutral sniffing position. At the point where we have our casualty positioned appropriately, we're going to insert the appropriate airway adjunct. In this case, I'm going to be using a nasopharyngeal airway that I have found in the casualty's individual first aid kit. All right, our nasopharyngeal airway is inserted. Now we're going to use our bag valve mask. So we're going to start by opening this up, taking out our mask, the BVM in its entirety. You got to kind of pull it open here in this configuration, and we are going to secure our mask to the ventilation port on the bottom of it. Okay, so now that we have our bag valve mask assembled, I'm going to use an EC technique. And what I mean by that is I'm going to make my fingers here in somewhat of an E shape and a C shape, with the thumb going over the part of the mask that covers the bridge of the casualty's nose, as well as my index finger over the cleft of the chin. And then I'm going to use the E, these 3 fingers, to grab the mandible and kind of lift the patient's face in an upward position while maintaining pressure with my index finger and my thumb, opening the airway by performing a head tilt chin lift maneuver. So while maintaining a good mask to face seal here, squeeze the bag with your other hand while observing the chest rise to make certain the lungs are being inflated effectively. Continue squeezing the bag once every 5 to 6 seconds so your adult casualty can maintain 10 to 12 breaths per minute. And then periodically we're going to check and make sure that our casualty still has a pulse, as well as observe for any spontaneous respiration. As always, make sure you document all of your treatment on a DD 1380, otherwise known as the Tactical Combat Casualty Card, and affix it to our casualty prior to transport. All right, so now we're going to demonstrate our 2-person bag valve mask ventilation techniques. So as I demonstrated earlier, we're going to stand at the patient's head, we're going to have him in a sniffing position, and we're going to use our appropriate airway adjunct. In this case, a nasopharyngeal airway that we found in our casualty's IFAC. So at this point, I would be using a similar technique with my bag valve mask. I'd be taking both my thumbs, putting them over the bridge of the nose, my index fingers over the cleft of the chin, and my pinky, my ring finger, and my middle finger underneath both sides of the mandible here. So really, this is helping us maintain a more effective seal on the patient's face. So at this point, our second rescuer is going to squeeze the bag with both hands, continuing to ventilate our patient, watching for chest rise. If the chest does not rise, reposition the mask to ensure a good seal. Tilt the head and lift the chin to open the airway. If the chest rises and falls, continue on. And we're going to squeeze that bag, same as before, every 5 to 6 seconds, so we deliver 10 to 12 breaths per minute to our casualty. As well as watching for spontaneous respirations from our patient, we want to go ahead and periodically check and make sure that the patient's still maintaining a pulse. As before with all of our treatment, we're going to document appropriately on a DD Form 1380 or Tactical Combat Casualty Card and affix it to our casualty prior to transport.